Hello, I'm Amy and this is my second video for my blog Little Surgeon. Today I'm going to be splitting the video into three parts. Firstly, telling you about what I've done since my last video and what I've done really since I've started surgical training, since this is my first clinical video. For the second part, I'm going to tell you about a case that I've seen recently, and in this case it's a gentleman that had a lower gastrointestinal bleed on the ward. And to finish off, I'm going to tell you about something I've learned recently. Okay, so what have I done since I've started my surgical training? Well, in terms of surgical experience, I am currently on a urology job, although I'm hoping to be a general surgical trainee in the long run. So at the minute I'm doing a little bit on urology and also a little bit in general surgery when I'm able to. In terms of the general surgery skills that I've got, I've learnt how to do incision and drainages, which is when someone has an abscess on their back or their neck or on any part of their body, and that's when you take that away, send off a sample. Another thing that I've done, which is what I've been doing previously, is a lot of appendicectomy, so taking out people's appendixes, and I've also been helping in bigger operations. In terms of my standard urology job, the things that I've done are cystoscopies, which are where you insert a camera into the bladder and have a look round for any abnormalities. I've also been helping with and doing circumcisions, which is when you take the foreskin off the end of the penis, and this can be for a variety of reasons, though a lot of the reasons I tend to do them are for medical reasons. Okay, so now I'm going to tell you about an interesting surgical case that I've seen recently. I walked onto the ward and hear that a crash call had been put out. For those of you that work on wards, you'll know exactly what a crash call is. For those of you that don't, a crash call is something that anyone on the ward can put out when a patient has either arrested, which means that their heart has stopped, or they're very, very poorly and you worry that they're going to deteriorate and they could be in a position where the heart would stop very soon. So as soon as I walked onto the ward, I got called straight into the bay. I put a pair of gloves on first. I think that's one of the most important things you can do, and one of the biggest lessons I've learned. Put the gloves on before you even walk in. Walked in to see a very poorly gentleman, lots of blood surrounding the bed, and one of the junior doctors and two of the nurses, the senior nurse on the ward, the senior sister, and one of the staff nurses. There's lots and lots of things running through your head as this has happened. If you don't know the patient, you don't know anything about them, you don't know their history, you don't know what they've had done, but you also want to make that patient well. We were very, very lucky that, as I say, because a crash call had been put out, lots of people came to join us not long afterwards. So what we're trying to do is we're trying to make the patient better. So we go through 8 E steps. So there are certain steps that you go through with any unwell patient. A, their airway. B, their breathing. C, their circulation. D, disability, and E, exposure. And you go through each of those steps doing various things to try and figure out exactly what's happening and exactly what you do. And we were very, very lucky that everyone seemed to do their parts, and the communication, I think, was excellent. People were seeming to have things ready before we even needed to. So as soon as there was a catheter, it was suggested that this gentleman needed a catheter, we were able to do the catheter. As soon as it was mentioned that there was an ECG machine was there, and everyone worked together so great. So what we did was we attempted to stop the bleeding. So we did that with a variety of trying to figure out what the cause of that bleeding was, and to give various medicines to try and stop that. So that involved both giving medicine to stop the bleeding and to also give this gentleman blood to replace some of the blood that he was losing. This gentleman did require a little stay on HDU, which is our high dependency unit, but actually because of the quick work and because of us managing to stop this bleed, or at least get on top of the management of this bleed quite soon, it actually meant that he made a full recovery and was very well following this. So I want to use the sections lesson learned to tell you about a lesson that I didn't so much learn from this case, but something that I saw in practice so well, done so well, and probably one of the best I've ever seen it. And this is about MDT, or multidisciplinary team working. Now, what this is, for those of you that don't know, is it is different people from both different specialities and different professions working together to give the patient the best care that they can possibly receive. So, as I briefly mentioned, there were lots of people there when we dealt with this unwell man. There was myself, so the core trainee, there was the junior doctor, there was the charge nurse, there was the staff nurse on the ward, there was the resuscitation officer, there was the anaesthetist, there were the junior doctors from the crash team, and then as soon as they could come down, there was the registrar of the patient, so that's one of the middle grade surgeons, and also the surgical consultant. In addition, because we requested blood, there was also the blood bank coordinator that arrived with the blood, as well as the porters that came with her to deliver that blood. So I just want to tell you a little bit about what everyone did and why this is so important. So the staff nurse that was looking after the patient, she was the one that put out the call, as far as I believe. So she was getting things together as we were asking for them. So she got the fluids when we needed them for the patient. She also got something called tranexamic acid, which is something to stop bleeding for the patient, and any medications that we needed. The senior sister on the ward, she was making sure that everything was coordinated, everyone knew exactly where everything was that they needed. Even something that I couldn't find on the crash cart, she knew exactly where to suggest that I got that from. Got the equipment that we needed very quickly. The anaesthetist, when she was there, made sure that there were no problems with the patient airway, made sure that the patient was safe, and made sure that the patient didn't arrest, so the patient's heart didn't stop. She also was there when we arranged that patient's transfer to the high dependency unit. The doctors that came from the crash team made sure that we didn't need any help, and were there to do things that we needed, such as taking bloods and taking venous blood gases, which is a very instant blood test that we can do. The junior doctor of the team was able to give everyone a summary of what was happening with the patient and the patient's care, and also be able to coordinate different people, make sure that the people that were there that needed to be there. So it was him that contacted the registrar and the consultant of the patient to get them down as soon as possible. The resus officer made sure that everyone knew exactly where to get things from, coordinated who was there from the crash team. My role was to overlook everything and make sure that the steps of the aid, because I've dealt with a lot of unwell patients, to make sure that everyone knew which steps they should be doing, and make sure that we were doing it in a safe order and in the right order to make sure we covered all bases. The registrar and consultant, when they came, figured out what we needed to do in terms of long-term plans, because we got the patient stabilised, and made decisions whether we needed to take that patient to theatre, whether we need to do something called a colonoscopy, which is a camera test up through the bottom to see where the bleeding was, or an endoscopy, which is a camera down the throat to see once again what the source of the bleeding was, and also to arrange further care, whether that be on the high dependency unit or on the ward. So as you can see, there were loads of people that were involved in that patient care, and if even one of them wouldn't have been there, it could have made it very different, and it could have made it run a lot differently. So I know a lot of people talk about multidisciplinary team working, but I think it's when you get to, I mean, if you work in a hospital, you'll appreciate people that work there and appreciate the different cares and the different angles that they can take on patient care. But it's when there is a big situation like that, and even if people aren't used to dealing with situations, everyone just works together so quickly and so efficiently just to make sure that patient care is the best it can possibly be. So if you've got any questions, once again, please leave them in the comment section. If you want to know when I'm bringing out future videos, please subscribe, and anything else, just let me know. Thank you very much.